member for Calgary Mountain View.
Thank you very much, Mr. Speaker. Fentanyl and other opiates of abuse continue to spread in our communities, and the consequences are deadly. Experts are indicating that we may be facing an unprecedented 1 death per day in Alberta by year's end. Mr. Speaker, these deaths are preventable and requires brave leadership from this government. Bluntly put, we need action, and we need it now. To the Minister, what instructions has the Ministry provided Alberta Health Services with regard to increasing access to naloxone and medication-assisted treatment for opioid use disorder?
Honourable Minister of Health.
Thank you, Mr. Speaker, and to the member for his question, as well as his service on the mental health review, which, of course, mental health and addictions go hand in hand, so this is an area that we've been working collaboratively on. There's a fourfold strategy. Increasing access to naloxone is a must. We know that it is one of those last-minute life-saving strategies, and we've been continuing to add more kits throughout Alberta and making sure that it's available in communities throughout Alberta. So that is certainly one of the pieces, as well as the other prongs include addressing recovery and addiction beds, making sure that we're cutting off supply, and also education on the front lines, because, of course, we want to cut off the...
First supplemental.
Thank you, Mr. Speaker. Well, as we enter the unique stresses of the Christmas season, and considering 1 death per day, will the Minister consider declaring a public health emergency to free up resources and allow her to free up access to naloxone for EMS workers who still can't provide it, nurses, and even responsible family members to provide this life-saving drug?
Honourable Minister of Health.
Thank you very much, Mr. Speaker. We know that there is a community response needed on this, and in terms of first responders, paramedics are currently able to administer and prescribe the antidote, so that is certainly good news. We are working to change regulations for EMTs so that they can administer naloxone as well. That is very important. All paramedics and pharmacists can administer naloxone in an emergency. And in terms of the question around provincial state of an emergency, I've been looking into this, and it's my understanding that wouldn't actually change any of the federal requirements which are governing this area, and I'd be happy to discuss that in more detail afterwards.
Second supplemental.
Thank you, Mr. Speaker. Well, that raises the question for the Minister, how hard is she working at the federal government to change Bill C2, which restricts access to harm reduction services in this province? How hard are you working on the federal government to change that bill?
Minister of Health.
I think I hear an offer from the member of the party that is now in federal government to support me in my lobbying efforts at the national level. Certainly, harm reduction is seen nationwide as being one of the best strategies to extend lives, and evidence is certainly driving our government's decisions on how we address issues such as the one we're currently facing, and I hope it will be the focus of the new federal government moving forward. But certainly harm reduction and access to naloxone is fundamental in addressing the fentanyl crisis.